So today we want to talk about RSV. This is a virus that has been showing up in the headlines, and allegedly there's a lot of hospitals full of patients with RSV right now. And so a lot of people are asking, well, what is it? Is it serious? What do we need to know? And so RSV may be, so it stands for, it's a little bit difficult to say, pronounce, but it stands for respiratory syncytial virus. And whereas RSV may be a new term to you, or maybe you've never heard of it before, or maybe unfamiliar, it's not an unfamiliar virus. This virus has been around forever, and scientists first discovered it in 1956, but it's been around for a lot longer than since 1956. And basically RSV causes the common cold, okay? RSV is a lot like other respiratory tract infections. It's a lot like other viral respiratory tract infections. So just like the flu or COVID or SARS, RSV is just another example of a viral respiratory tract infection. A lot of its symptoms are similar to other viral respiratory tract infections: coughing, congestion, fever, sore throat, things like this. Now, and similar to other viral respiratory tract infections, it's really not that dangerous for healthy people, okay? Just like the flu or COVID or anything else. And as is true with other viral respiratory tract infections, it can be dangerous, or it can be serious for those who don't have a strong, healthy immune system. It can be dangerous for, young infants who their immune system hasn't developed yet. It could be dangerous for the elderly, for the immune compromised. And so what's interesting is there was a scientific article published that said that nearly all children have an RSV infection before the age of 2, right? So whereas this seems like maybe a new thing because it's made headlines recently, it's not new. It's been around. There is a basically 100% chance that you have been sick with RSV at some point. It's the common cold. Basically, the virus is everywhere. Any attempt to avoid exposure to it is going to be futile. The virus is everywhere. Virtually every kid in the country has had RSV infection before the age of 2, and as an adult, it's nearly 100% guaranteed that you've been exposed to RSV at some point in your life. You've been sick with RSV at some point, and you're probably going to get sick with it again. One of the things that we want to always focus on is what can we do to strengthen the immune system and be able to handle these viruses, these viral respiratory tract infections well. And of course, we don't ever want to see kids get seriously sick and end up in the hospital. And so while obviously the immune system is very large and complex, and there's a lot of factors that influence whether kids get sick or not and how serious the sickness is, vitamin D is an incredibly important factor to take into account. And look for a future video and a future article on our website about maternal vitamin D levels and the need for pregnant moms to supplement with vitamin D and pay attention to their vitamin D levels, because that has a direct effect on the health of the newborn baby. But a couple statistics or a couple studies, I wrote these down to make sure we didn't miss any. So 2017 in the Journal of Pediatrics, they found that 50% of hospitalized children were low in vitamin D, hospitalized with RSV. In 2011, in the Journal of Pediatrics, they looked at cord blood of newborns, and they found that vitamin D deficient babies were more likely to get RSV. And then just in 2023, in the European Journal of Cell Biology, they had a great article about how your lungs are a physical barrier between the outside world and then the inside of your body. So there's a cell type called epithelium, and the epithelium is like the lining of your lungs, and it is literally a physical protective barrier, and vitamin D plays a crucial role in keeping that protective barrier healthy. And the article basically suggested that vitamin D can help prevent RSV infections by building up and maintaining that physical barrier in the lining of your lungs. And so these are some things to consider. Obviously, we don't give direct medical advice on this channel or in our articles, but something to consider is for pregnant moms, paying close attention to your vitamin D levels. Now, if you're already, if the baby's already born and you want to make sure that they're giving every possible chance to have a strong, healthy immune system, consider a vitamin D supplement for the baby. If you are a nursing mom, your baby will get vitamin D through breast milk, but if you are low in vitamin D, it's going to be hard for the baby to get enough vitamin D. So these are all things to consider, and look for more articles and future videos from us about these exact topics. All right, I hope this is helpful. Love.